Health and Human Services Secretary Robert F. Kennedy Jr. is dismissing all 17 members of the Advisory Committee for Immunization Practices. The panel acts as a key advisor to the CDC. It assesses the safety and clinical need for vaccines across the country. Insurance companies and government assistance programs are required to cover vaccines recommended by the panel. Secretary Kennedy announced the move in an opinion piece in the Wall Street Journal yesterday, saying this will restore public confidence, as some of the members he is relieving of duty are Biden administration appointees. Officials say the panel will still meet as scheduled at the end of the month, but is unclear when the new members will be selected. Let's bring in NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, I guess, first of all, what might be the impact of this move? And was there any other reason that these people could have been dismissed except for the fact that they were appointed by Biden?
Short answer is no, Mika. You know, if it's still up, and it was up 2 minutes ago, I encourage all your viewers to Google ACIP, ACIP, and the CDC, and you'll go to the roster that's still live. I'm surprised it's live, probably for the next few hours. And you can read the bios of the individuals currently on ACIP through June, end of June. These are professors of infectious diseases like Dr. Helen Chu at the University of Washington. They're professors of epidemiology like Dr. Jane Zucker at SUNY Downstate, not far from you. And in no way, there are conflicts. Kennedy, in his piece at the Wall Street Journal, said that there was conflicts of interest, that somehow these individuals are in the pocket of pharma. That's not true. That they have to submit very rigorous conflicts of interest forms that are scrutinized. They cannot hold stock in advisory committees, anything to do with vaccine manufacturers. So there is no relationship between any of these individuals and their credentials and a conflict of interest, number one. But to your point, you know, what is this going to mean? I'm very close to the American Academy of Pediatrics, and we just had a town hall in this conversation in the wake of his announcements over the last few weeks. What does this rolling thunder set of announcements, Mika, mean for public health? And it's pretty darn clear. No clinician likes the fact that he's doing what he's doing. He's doing exactly what he said he's been doing. He's doing exactly what he's done for the last 20 years, which is reducing confidence in vaccines. But no clinician wants a lack of transparency and a lack of clear guidelines that's not expert driven. And that's exactly what he's doing, number one. Number two, he also knows that insurance companies rely heavily, Medicaid relies heavily on what ACIP recommends. If ACIP says we need to get a flu booster or MMR every few years, they're going to have to cover it. It's actually statutory by law. So he knows what he's doing. He's actually undermining the very framework of how we get vaccines covered for the American people, including kids. And he's going right at the heart of that.
As you say, Dr. Gupta, this was all advertised. We knew who Robert F. Kennedy Jr. was, who he's been for the last several years, once a great conservationist, environmentalist, now guided in his public life by vaccine skepticism. So you started to get at it, but just for even parents watching at home, what could change in their relationship with their doctor, with their pediatrician, and vaccines if this board comes in, we expect, filled with fellow vaccine skeptics?
Well, Willie, you know, what I would say, number one, is look at the doctors, so-called doctors, that he has surrounded himself with, RFK. These are former doctors who once practiced medicine, or doctors in name only who have never practiced the art of medicine at the bedside. And so why does that matter? If you don't have somebody that understands the consequences of something fundamental, like we're going to ruin the vaccine or the infrastructure for people to have access to vaccines, if you've never dealt with the consequences of caring for a patient, you're going to run roughshod. You're not going to have accountability. And so that's the phenotype that I worry he is going to surround himself with in government and these types of committees, Willie. What does that mean fundamentally? He has this ACIP, a revised ACIP. He can now appoint all new 17 members. He doesn't have to wait till 2028, which was the original deadline that they had to wait till 2028. Now he can do it tomorrow if he wanted to, or in July. The worry here is that this committee is powerful enough to completely revise the vaccine schedule for children. And he can go on and say, or this new committee can say, you know what, we don't like the recommendations as they exist today. We're going to completely alter them. What does that mean for the everyday family? That means that once covered vaccines by insurance companies may go away. Unfortunately, that is part of the risk here, Willie. What I hope, and I just to say, I hope insurance companies fundamentally rethink how they cover vaccines, because they can no longer rely on ACIP or what the government says.
So this clearing out of the vaccine committee by RFK Jr. breaks a commitment he apparently made to Republican Senator Bill Cassidy of Louisiana. Here's what Senator Cassidy said was promised back in February before RFK Jr. was confirmed, followed then by the senator's response to reporters yesterday when asked whether he now regrets his vote.
He has also committed that he had worked within current vaccine approval and safety monitoring systems and not establish parallel systems. It confirmed he will maintain the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices recommendations without changes.
Do you regret your vote on RFK Jr.?
You know, Manu,
you can refer to our tweet on that.
I'm asking a question. And I know you're asking a different question, but you're trying to get us something similar. And this is not going to come from that.
So Senator Cassidy directing reporters to this statement on social media where he wrote, of course, now the fear is that the ACIP will be filled up with people who know nothing about vaccines except suspicion. I've just spoken with Secretary Kennedy, and I'll continue to talk with him to ensure this is not the case. So, J-Mart, that first clip we played was Senator Cassidy back on February 4th. What a difference 4 months makes. He got this guarantee before locking up Senator Cassidy's vote from RFK Jr. that he would not do what he apparently is ready to do.
Which was the pivotal vote, we should tell folks.
Right.
If it wasn't for Cassidy on the Finance Committee, he wouldn't have gotten confirmed.
Cassidy's a doctor, by the way. We should remind people.
He is a physician, and he was anguished over this vote. And I think it was very difficult. And classic challenge, politics and principle colliding here, Willie. And he's facing a tough re-election in a deep red state. He already voted to impeach President Trump in 2021. And I think he came to realize he wouldn't have a chance if he torpedoed Kennedy for the cabinet, and so he voted to confirm him. But before he did get these assurances. But it turns out, like so many of the cabinet folks, those assurances weren't worth the paper that they were written on, and they were only offering those assurances to get through the confirmation process. And now, once they're free and once they're out of the purview of the Senate, they're going to do whatever they want to do. But just real fast on this, we're talking about the riots in L.A., so which obviously terrible politics for Democrats. This is a reminder, though, that Trump giveth and Trump taketh away, right? Trump will always do stuff and say stuff that is going to alienate people. So, yes, it looks terrible to have people in the streets of L.A. burning American flags, burning cars. But yet Trump has his top, appointee get rid of this board of serious doctors to replace it with quacks. It's just a reminder that Trump will always do stuff to keep Democrats in the game somehow. Mm-hmm.
So, Dr. Gupta, how concerned or worried should parents and pediatricians be about the future access, availability, and approval of vaccines that are critical to children's health as well as adults?
Mike, they should be worried. And unfortunately, until we start to see a different way for insurance companies to think about a different framework, Mike, in terms of how they cover vaccines, new vaccines, boosters, because right now it is heavily dependent on what Kennedy is hollowing out. ACIP, CDC, FDA recommendations that he has complete control over. He has a lot of authority and power. He is exercising it irresponsibly. But until insurance companies say, you know what, we're going to think about this differently, because, by the way, prevention is cheaper. They think about the bottom line, unfortunately. Prevention is cheaper than caring for a child in the hospital. That's how they're going to think about it. And in this case, they need to be thinking about the benefits of prevention, a political view on evidence. And we need to have a framework here that has not existed in decades, which is them ignoring fundamentally what is coming out of HHS. Mike, unless we see that start to happen, and I suspect we will, if we do not see that start to happen, access is going to be significantly hampered.
All right, NBC News medical contributor Dr. Vin Gupta, thank you very much for your insights this morning. We appreciate it. Politico's Jonathan Martin, thank you as well. Always good to see you. And